So before we get started, if you have any questions, go ahead and type them in the chat box and we'll get through as many as we can during the Q&A session after the talk. And then we also ask that you please keep your microphone muted so that we can make sure we have good audio quality. So I'm very pleased to introduce our speaker for this session. Dr. Lahia is an assistant professor of medicine in the Division of Nephrology at the University of Texas Southwestern Medical Center in Dallas, where she also received her medical degree. Dr. Lahia leads the PKD clinic at UT Southwestern, where individuals with PKD and other genetic kidney disorders receive comprehensive individualized care. Her research laboratory focuses on understanding the metabolic and epigenetic factors underlying ADPKD disease severity. Dr. Lahia, my pleasure to turn the presentation to you.
Thank you so much, Elise, for that kind introduction. Let me share my screen with you. Great. Well, thank you, everyone, for joining us today, and thank you to the PKD Foundation for this opportunity to all of you about a very important aspect of PKD care, which is communicating with your healthcare team. You know, I've had the privilege of training here at UT Southwestern and studying polycystic kidney disease. And as part of my training, when I joined the faculty, I actually opened the clinic here. And it is what I've learned from my patients over the last several years through this clinic that I'm sharing with you today. You know, it is you that has influenced what has kind of molded in my mind what is the best way to communicate and assemble your healthcare team. And so I look forward to the questions that you have and hope to kind of build on that as well moving forward. Well, let's get started. So this is a disclaimer. We'll kind of move on from there. In our disclosures, I have no specific disclosures here. Elise was kind enough to introduce me. And so what are the two main things that we want to talk about today? The two main things that really are on the agenda for us to discuss is what are the healthcare professionals that need to be included as part of your healthcare team? You know, I'm sure that this is a very broad audience of those that are, you know, extremely educated and know everything about polycystic kidney disease. And then there are those that have just recently been diagnosed and are learning about this. And so it can be overwhelming. And that's one of the things that we're going to address today. And then the second topic is how do we communicate with our healthcare professionals and who do we call for what? And so I hope that, you know, through the next, 25 to 30 minutes, we can go over that. And then I want to take your questions and really see, you know, what is your viewpoint and what is it that we can do to do better? So as we got started, as a reminder and maybe a little bit of a refresher, you know, there are many complications of polycystic kidney disease that all of you deal with, and everyone deals with different complications. Here are a few examples. One of the most common places that we see these cysts outside of the kidney is in the liver. So on the left here, you see that this individual has many liver cysts. And sometimes those liver cysts are so bad that they cause pain and complications. And then you need to go see a liver doctor. So that's called the hepatologist. You know, so that is one extra doctor that you potentially. In addition, your kidneys develop these cysts and they can grow quite large. And this is a very burdensome disease oftentimes. And pain is a very concrete problem that many individuals with PKD have. And so you may need to see a pain specialist or even a pain specialist that specializes in kidney care. Another example, kidney stones. Kidney stones are more common in individuals with polycystic kidney disease compared to other kidney disorders. And so you may need a kidney stone expert or a urologist if your stone gets stuck. How about a few more? And you can see how this can become overwhelming and complex. One of the most feared complications that we think about is the concept of an aneurysm in your brain. And do you need to see the neurosurgeon? What about the heart? The heart also has this mutation. The mutation is in your whole body. And so you may need to see a cardiologist for several different types of defects your heart may have. Sometimes you have cysts in your pancreas. Some individuals have a hernia. As you can see over these two slides, there is a slew of doctors that you may potentially need to see. But do you really need to see all of them just because you have PKD? The answer to that is probably not. How do you decide and who should really be on your team? So as part of developing this clinic here at UT Southwestern, I realize and I understand the importance, and I want to emphasize the most important thing I think you really need is the 4 doctors and four groups of individuals I'm going to list here. So number 1 is your PKD specialist. And this is someone who really is that person in your corner who knows all of these complications that can happen, who knows who to reach, the right people who have an expertise in PKD and the liver, PKD and the heart, and who can get you to that right place. Now, I understand not everyone lives by a PKD center. We don't have one on every corner, and we don't have one in every city even. And so many individuals do travel far and wide. Do you have to have one? I think it would be great to have one that you see hopefully once a year, or, if your disease is mild or you don't need too many things, maybe once every couple of years. But then you do need a local nephrologist. And oftentimes, even when you have a PKD specialist in your area, you may work with your local nephrologist as well together. And so it's important to have a kidney doctor near you, but you do need someone who really understands this disease, especially now. I would say if you asked me 20 years ago, would that be the case? Maybe not really, given how little we knew about the disease. We knew so much, and yet we knew so little, and how little we could do about it. But now so many things, as you've seen in this conference, are changing. Our knowledge has gained so much, and there's so many exciting options that may potentially become therapeutic out there, or different interventions that you can do with diet and lifestyle and things like that. So I think that benefit of having that PKD specialist in your corner at some point in your lifetime with polycystic kidney disease is really important. I think it will give you a valuable tool in your box of understanding this a little bit better and helping coordinate your care. But in addition to that, you need a primary care doctor. As much as the PKD doctor and the kidney doctor want to be your primary care doctor, unfortunately, they don't always have the resources to help take care of those things that not necessarily have to deal with the kidney or something else. And so you want a good primary doctor, especially if you don't live very close to a kidney doctor or a PKD doctor. Having a good primary care doctor that communicates with the kidney doctor would be in your best interest. And then finally, your family and your friends. I think this is a very, very important component. You need support to deal with this. And whether it's friends or family, it's very important that you take that time to hopefully you have that support, or develop it through conferences such as this, Developing Friends, like that, help get you through and understand, because it's very helpful to have an extra ear. I personally have learned over the last several years, taking care of loved ones, medical illnesses. Our healthcare system is extremely complex, especially when you see multiple doctors in different places. Because here I am telling you to go see the PKD specialist, and then, but that system is different than the primary care doctor who has had this practice for 30 years and is a fantastic physician, but their charts are on paper. And having all of that together and coordinating that, but to have a group of family or friends that helps, listens to you, knows what's going on, and helps you navigate that, can really be a tremendous asset to you. So how do we decide who needs to be on your team? And we've been over this a little bit, but let me give you a few examples of some cases, because it really just depends. So here's our first case. Sally is 32 years old. She was diagnosed with polycystic kidney, and she developed some lower back pain, and she was found to have a kidney stone. She went to the emergency room. She didn't pass the kidney stone, and she needed surgery to take the stone out. She didn't have any other complications of PKD because her PKD specialist that she saw once a year, went over and asked the questions and had them together. So who does she need to see in addition to the primary care doctor and the kidney doctors? She needs to see the urologist to make sure that her kidney stone was removed, and also a kidney stone expert. So there is such thing as a kidney stone expert who is not a surgeon that can help reduce your risk of developing future kidney stones. And so that is someone that we referred her to understand what is causing her stones. Is there a way to change her diet? Does she need to drink even more water than she's already drinking? Is there any medicine that will help prevent her from getting more kidney stones? Let's go to the next case. Case 2. Ben is 42. He has known he's had ADPKD since he was 20. He hasn't had any problems. But he recently developed some headaches, and he told his primary care doctor, who knew that he had ADPKD. And she reached out to the PKD specialist and said, okay, well, that's a trigger. Let's get another MRI. And it showed that he's developed a small brain aneurysm. Well, we saw that and we sent him straight to the neurosurgeon to take a look at it. He was monitoring it and evaluating it. He didn't have any other complications, so he didn't need to see any other doctors at that particular time. Go to the third case. So Elizabeth's 60 years old, and she noticed that her belly was getting bigger, but overall she was losing weight. Why was she losing weight? She was losing weight because when she tried to eat, even though she was hungry, she couldn't get any more food down. And when she saw her primary care doctor, he did a CT scan and he saw the polycystic kidneys, but he also saw the polycystic liver. And when they sent that over to the PKD specialist and we started asking more questions, we realized that she couldn't really eat because her liver was taking up so much space. And that is a very need that sometimes individuals with polycystic kidney disease develop. If it's their liver that is the bigger problem, you can potentially get a liver transplant because you're losing weight, and that is a quality of life issue. And in that particular scenario, we sent her to the liver doctor, the hepatologist, and the transplant surgeon. And they said, yes, she meets this very special criteria because of the bulk of the liver. And she received a liver transplant and is now doing much better. And then finally, your needs can change over time. So for example, Amelia is 42 years old and she has pretty aggressive polycystic kidney. Her kidneys are only working at 18% of what they should be. She has high blood pressure. Her EKG to look at her heart was a little bit abnormal when she saw her primary care doctor. She's overweight and she's very educated about polycystic kidney disease, and she knows she's going to need a transplant. So she's asking, is there a limit to how much I can weigh to get a kidney transplant? Is that going to keep her from getting a kidney transplant? And then finally, she wants to learn about dialysis, and she wants to do peritoneal dialysis when her kidney fails if she hasn't received a transplant. So who does she need to see? She needs to see the cardiologist about her abnormal EKG. She needs to be referred to the kidney transplant program because her kidney function is less than 20%. She needs to see a weight management group because she's very active and she wants to get a kidney transplant, and she's planning for this ahead of time. And then she needs to see the surgeon so that way when she needs that dialysis catheter placed, he knows who he or she knows who he is, and they know that it's safe to put that dialysis catheter when it's time. So essentially, her kidney doctor and her PKD doctor are working with this team here to get everything ready to go such that she can have a kidney transplant, she can be placed on a kidney transplant list. And she can have, if she needs to start dialysis before she has a kidney transplant, that everything is planned and that there are no emergencies and she doesn't urgently need to start dialysis or become very ill. So as you can see, that extended team will really be determined on what you need. And this can change over time. This is a lifelong disease. And so this coordination of care by your PKD doctor and your primary care doctor is really integral to deciding who you really need on your team over the course of your lifetime, really. And this list only really includes the other physicians and healthcare team members that you may need from a PKD genetic disorder perspective. You may have other conditions, other medical problems, and those members may need to be on that team as well and all talk to each other. So how do you prepare for your appointment with your PKD doctor? I just told you there's a list of many doctors that you may potentially need. You just found out that you have polycystic kidney disease, or maybe you've had it for some time, but really haven't had any problems. Should you think that you need these? Someone said you had liver cyst. Do I need a liver doctor? How do I do all of these? But before your appointment, I would really encourage all of you to write down all of your questions and your concerns. Ask your family what questions or concerns they have. If you can, try to send them to the doctor beforehand. If they have an electronic record system where you can send a message to them, say, Dr. So-and-so, I'm going to see you. I just want to send you my list of questions ahead of time that we can discuss when I come. This is extremely helpful because it really, even if they've only had 10 seconds to look at it before you came to the clinic, it gives you an idea of where you're coming from. And if sometimes there's difficult questions, then they can have some time to find the answers, and your visit can be more productive. Although we're more than happy to answer, to say we'll come back and talk to you, sometimes that's a little unfulfilling to the patient. Say, well, my questions got asked, but they did not get answered because we didn't have them at that moment. But it kind of gives your doctor a little bit of more time to kind of get everything together, potentially, and see where you're coming from as well. Make a list of all of your medicine supplements you take, and take pictures or bring them with you. So this is extremely important when you see multiple doctors at different healthcare facilities. We don't know exactly what you're taking, and sometimes it's not because of the way the electronic system communicates with the pharmacy. It's not 100% perfect. And so every time I see someone, I always go over that list of medicines with them just to make sure that we clean it up and it looks proper, because it can change, and we know that it will change. But bring what you're taking so that way we know what it is, and even every single supplement that you bring as well. One of the most common things I'm asked about is if it's okay to take a particular supplement. And there's so many out there right now that it is difficult for me to keep up with new things and I'm very worried that what you're taking may potentially not be safe. And inevitably we say, please send me the label. You just bring it with you or send a picture with it. That is incredibly helpful, because we want to make sure that what you want to take or what you heard about is safe for you. And that's why you're showing it to us as well. Bring your CDs. I know you see many doctors from many places. Bring your records with you from your other doctors. If they gave you a piece of paper after you saw the heart doctor and this and that, don't assume that we got the information as well. Bring it with you if you have it. I'm not telling you to bring the whole portfolio, but bring the few things from the last visit that you had, or write it down. And if you got some pictures, or if you were in the ER for some reason, and they did a CT scan, bring it. We'll upload it into our system and we'll have it on file as well. Because every piece of information that you can give us, is one more piece of information about you that we now know. What do you do during your appointment? Now you're here. You've made that list of questions. Ask all of them. Get the answers. Repeat the answers out loud to make sure that you understand them. And if you don't understand, ask them again. As a population, individuals with PKD ask the best questions, I think. Really thought about them, really read, so many things, and you ask some very tough questions sometimes that I don't always have the answer. And sometimes we don't do a great job explaining. And so ask again and make sure that you get that answer that you want, or if the answer is we don't know, then we will simply say we don't know and we will find out and get back to you. This community is a very cohesive community, both from a patient perspective, community perspective, and then from the physician and the scientist perspective. And it is very easy for any of us to reach out to someone else who sees patients and ask them, have you ever seen this? Someone asked me this, what did you say to that? And so that's what I always tell my team or my patients, is that if I don't have the answer, I have the ability to reach out. And when you get me, you don't get just me, you at my institution, and then you also get the PKD team, and we have no hesitation reaching out to each other for advice or answers to questions. So please just ask all of them. Make sure you understand what the answer is, and we can work on, making sure that we do a good job of communicating answers to you. Do not be shy. When I talk about understanding the answers to the questions, ask what the meaning of these medical words are. There are no silly or unnecessary questions. We want to know. I really want to know. Is it really supposed to hurt here? I read this, or my friend with PKD takes that. Do I qualify? This medicine makes me feel bad. You need to say so, because until you tell us that some of these things are going on, we don't know. And everyone is different. The medicine that 1,000 people take that they have no problems with, you may have a problem with, and it may not make you feel good. And we really want to know that. But please don't be shy. And by extension of that, be honest. There is absolutely no judgment whatsoever. It makes it so much easier when we have a relationship where we trust each other. The physician is a human, and they may not know everything, and they will say so. And at the same time, it is much easier to just say, doctor, something bad happened, we know life happened. I haven't taken my medicine in a week and a half. That makes complete sense. Of course, it's unfortunate that happened, but that makes me understand why your blood pressure was high when you came to clinic or things like that. We do figure things out. We know when sometimes when some of these happen, but it's a lot easier when you just tell us what is going on, because there is absolutely no judgment. We really understand that everyone's life situation is different and stressful, especially within the last year. And so, finding a way to make your healthcare and make you do well with the environment that you have is what we have to work with. And it's different for everyone. And the best way to cater to that is to be able for us to have a relationship where we understand where you're coming from and where things are and are not working, so we can make everything work the best that we can. So ask what is new. I really encourage you to ask your PKD specialists and your kidney doctors what is new. This is such an exciting time for people. And I know many of you read all of the science and the news articles and the newsletters from the PKD Foundation about what is new. But ask what is new, because it makes it for a very exciting conversation. You can see what's there. And as you develop this relationship with the physician, you can see how those new things are progressing. There is research out there, there are clinical trials out there. Do you qualify? Even if you're not interested, if you don't want to be in it, but just know that it's there coming for you. Are the drugs approved? Do I qualify for them? One of my favorite things that happened was a few years ago was a paper came out in a scientific journal, and the next morning I got 3 messages from patients who have no science background. They had seen it and they asked my thoughts about it. And I'm not saying you need to read science papers, but the fact that these things catch their eye and you have questions about them, you see them, you read it on a blog, ask about it, ask what is new, because it keeps us on our toes, and that's good. And it actually will make you more involved in the care that you're. What else should you do? And understand the answers to the questions, but write it all down, or write as much of it as you can write down. We try to make a point to write down the most important things for you to take home on a piece of paper, but listen to what the healthcare team is telling you. Write down the notes to the best of your ability. And, one of the things to consider, especially when you have, new things going on, is to consider bringing a family member. I apologize for that typo, but especially if you are nervous, if there's something new going on or things are not working and you're frustrated, bring a family member with you, because sometimes it is a lot of information, especially as if unfortunately your kidney function is declining and we're heading towards transplant or dialysis, or if your pain is not controllable, things like that. And it's really, really burdensome, Bring someone with you to help you answer or write down things, so that way you don't feel like you're taking it all upon yourself as well. And then what do you do after your appointment? Make sure that you understand when you walk out the door what the plan is. It can be overwhelming, but to understand a few things, ask the doctor to kind of go over it with you one more time, or the nurse as she's checking it out. Like, what are the few things that you need to do? You have your next appointment. Are the medicines that needed to be changed or adjusted for the referrals that you need? Know when you're supposed to go back. Oftentimes we ask you to reach back out to us. Let us know how you're doing with your new medicine or with your blood pressure or things like that. Write it down on your calendar. It's easy to forget sometimes, that these things need to be done, but reach back out to us, because we are thinking about you. We do worry and we want to know how you did. And it's very anxiety provoking, at least for me, when I don't hear back from you, and then I go back and start calling you to find out what is going on. And oftentimes, most of the time, it's because things are just fine, and that's why I haven't heard from you. But we want to know about it. And so after that appointment, mark it on your calendar of what you're supposed to do and communicate back. And that actually builds the relationship to know that we're going to get that information back from you. Gives more leeway about how much we can do from going back and forth through electronic charting and things like that. But how do all the members of the team communicate with each other? If you have to see multiple different doctors, if one person sees you, for example, and they adjust one of your medicines, then you go see a different doctor and that they adjust it again, how do they know? Ask all of your doctors to send communication to your primary care doctor, your PKD specialist, and if you also have a kidney doctor, a kidney doctor. So that way they see all of those things, even if it's as small as simply getting your colonoscopy because it was right age to it, or if you had your mammogram or something like that. But ask them to send all of that to the primary care doctor and then to the PKD specialist. If you had hip surgery and knee surgery, let us know that these things happen, and it all goes in your chart. And we see that, and it is our job also to communicate back to, to your primary care doctor as well about what is going on and what our plan is of what it is. Ask them to make sure that they get sent. And then how do you reach your doctor? So one of the things that I would recommend is that you really ask each member of your team how they prefer to be reached. Some offices prefer to get a phone call. Others prefer to send a message through the electronic medical record system. If you have a hard time reaching a team member, let them know and see if there's a simple solution. If you sent that message to the electronic medical record and you just haven't heard anything back in a reasonable time frame, pick up the phone and give them a call. Sometimes there's some simple solution. There are glitches in the system, or maybe that person was out and they never saw it. But if your concern is urgent, it needs to be addressed. And don't hesitate to reach out and tell them, I did do this. What is a better way for me to do it? Because it didn't work itself out. And there oftentimes is a very simple solution of what it is that we do, so that way we don't have that glitch in the communication or the time span of what is going on. And then who do I call for what? In the ideal world, you have this primary care doctor that takes great care of you, and you have a PKD specialist who wants to do everything for one. But they're hard sometimes, not in different places, or you're not close to them. So what do? If you think it's related to your polycystic, call the PKD specialist office. And some examples include if you have blood in your urine, really bad back pain, blood pressure that's been under control is no longer under control, if you have swelling in your legs, amongst others. You as a group are very smart. And when you feel like it's your PKD, that's the problem. And so call them, they'll tell you, what are the next steps to do? Oftentimes, it is telling you to go back to your primary care doctor because they can take care of you within 20 minutes. And then we work with the primary care doctor to see what's best or to send you to the emergency. But call them if you think it is, okay? If it's something that's related to a complication of your PKD, like for instance, if you've already been seeing a pain doctor and your pain medicine's no longer working, or if you've been seeing a liver doctor or a heart doctor, reach back out to them. Go ahead. You don't have to start with the doctor. Start with the one that you think it is. You are a very smart group of individuals, and you know your body best. So go ahead and start and reach out to them. What about the regular cough, cold, I'm tired? Do I need to see a specialist every time I have something, what I think is small? No, you don't. Start with your primary care doctor. If you have a question, if they start you on a medicine, you're not sure if it's, just ask them. They're very aware and they will check. And if they're not sure, they will reach out. I commonly receive phone calls, just double checking to make sure that it's okay to receive medicine. If you have any other concerns, start with that primary care doctor, okay? And then if it's something related to medicine, or if you need a refill on a particular medicine, try to get it from the doctor that prescribed it. And the reason that's really so important, and I know sometimes it can be a juggle if you have multiple doctors, is because we want to know that I prescribed this for you, and then now you need a refill, which means that you're doing well with it, or things like that, or if it's not working, or are you even still taking it? And so that way it helps us keep track of you. That we're refilling it because we're the ones that are helping manage that particular medication, okay? And then finally, if it seems serious, go to your nearest emergency room or urgent care center. You know what it is, you know your body best. And so take that time, go ahead and go. You can call your primary care doctor on the way and let them know what's going on. Call your PKD doctor on the way and let them know what's going on, or afterwards. Or if they wind up saying it's related to your kidney and you have concerns, ask the ER physician to call your PKD doctor. I'm commonly receive phone calls letting me know that so-and-so came and this was going on, or if I have some additional recommendations of what should be done, okay? But you know your body best, and we really do trust you to understand when it is the emergency, especially when it's, after hours and it's a little bit difficult to get a hold of your primary care doctor or your PKD doctor. It can be a scary situation sometimes. I understand that. going to the nearest facility is perfectly. But finally, after all of this, and before we bring up some, time for questions, what are the most important things I want you to take away from this? I really want you to start keeping a list of your questions and concerns. Maybe just keep it jotted down to the side. If you see your doctor every 6 months or once a year or something, just add it as it comes. Organize what you're taking, your medicines or supplements, and then keep a record of all your physicians, your contact information for all of them. So that way you have a very good go-to to go to, and to be comfortable asking questions like that. So with that, I would really like to thank you for your time, and allowing me to do some tips and what I have learned over the last 5 or 6 years about about community and how to have a successful relationship with our patients and to have them succeed in their healthcare. And I'd really like to take any questions that you have.
I have a question.
Yes.
Dr. Lahia, my name is Karen Solomon Edwards,
Nice to meet
and
you.
I'm very thankful for this presentation that you presented. It is very vital and information. As you were talking, I was listing the name. I have a total of 8 or 9 physicians. They're all at a major complex in the city of Detroit.
Right.
And the information that you provided, most of it I know now after 8 years. Had I known this at the onset, I think my kidney journey would have been much easier.
Mhm.
Now, I encourage all of my fellow kidney patients that we have to be more active in our care, because what I have encountered is that with all of these 8 doctors, nephrologists, and endocrinologists, I had to learn all these different names: the kidney doctor, the transplant doctor, the neurologist, endocrinologist. All of those doctors, some of them are not communicating. And they're all on the same system. And they're asking me these questions, and they're especially not communicating with the medicine. And as a result, I was prescribed a medicine that the other doctor told me a month ago, don't take this. This causes diarrhea. Then I go to this doctor. They prescribed it. They said, just try it for a month. I tried it that one day. I had diarrhea. So the problem that I see, and then there are some caring and concerned doctors, but the problem is they're not communicating. There's no communication, or either they're not looking at the medical records to see what the other doctors are prescribing or what was said, because my medical history is like a book long, and it's all there, but they're not communicating. What do you suggest?
I completely understand where you're coming from. Like I said, through even my personal experience through my family, I have firsthand seen in the last 2 years how complex and frustrating it can be to navigate the healthcare system as an outsider, as a non-physician. And even that advantage of me being a physician that helped me see some of these ways to kind of make it happen is still incredibly frustrating. I think it starts with the core, and that core really needs to be, you need to have one doctor that really knows everything, and be able to have that kind of center help you, and you be part of that center with your family, but yes, you have to be active in your healthcare, and you need to have that one person that is able to know all of those things, and I will be very honest with you. I mean, even when it's in one system, sometimes, through this, there is some lack of communication. We're still trying to learn to make this work from our end. I'll be very honest with you, and sometimes despite our best efforts, that communication doesn't make its way through, and we talk about this, how do we make that better? And we are getting better over time. We really are, we're trying our best, but having that one doctor, I would suggest having a really good primary care doctor that has all that information. And for you to let that doctor, or either the PKD doctor or the primary care doctor, or both, send them a message every time you go see someone else. I went to see someone else and they started me on this, and that will be that record for you, and so that will be that put together for you right there. Because sometimes you are the best advocate for yourself. And we really need you in how complex, just like the internet and the information overload that we get now in the real world, our medical system is sometimes the same way, and we need to be able to put it together. And we need your help to do it, to be honest, and it's the most successful that way.
Yeah, great question, Karen. And Dr. Lahia, thank you. That was a really excellent presentation. I have a few other questions that have come through on the chat. And if everyone wouldn't mind, just go ahead and put those questions there. We do a little bit of a queue of questions. I want to make sure we get to as many as we can. And the first one, if I could just steal the first one is, I know with COVID, we've had a really different concept of using telemedicine for managing disease, and how and do you use telemedicine in your practice, and what do you think is an appropriate reason to see a doctor over telemedicine as opposed to an in-clinic visit?
Great question. Yes, we use telemedicine in our clinic. We switched to that, and now we do a combination of both. I think that you need to see a doctor in person if you're otherwise relatively healthy, at least once a year, okay? And then when you see your PKD doctor, your kidney doctor, I actually want to see you in person at least once, okay? With COVID, it has been hard to see new patients in person right away. We're still transitioning back to everything in person as much as we can. But I've had many patients that I've seen brand new during the COVID time point, and we've said, okay, next time you come, I want to see you in person because I really do need to see, do you have swelling in your legs? You can show it to me. We've gotten very good at some of those things, but I need to see you once, and then we need to make a decision together. How often do we need to see you in person? And what can we do with telemedicine? Because that can be very productive, actually. It lets you stay at your job, make all my patients on time for their appointments, and I'm not late for seeing any patients either. So in that way, it works very well. It also allows me to show you what your scans look like, which we can do in person, but I can still do that over telemedicine. And so, I think we should continue doing some of that, especially when you live far away and things like that. But, I really do think that we do need to see you. I mean, I would like to see you at least once a year. And if you have more complex things going on, more frequently, whatever is best for you, we have to tailor it to the person.
Sure. Yeah, it's always a conversation. We've had a lot of questions too in the chat about how to know if your nephrologist is familiar enough with PKD to really manage it appropriately. Do you have any maybe warning signs that someone could tell their nephrologist might not know what they should know for that kind of care?
So I think the biggest takeaway is that what has changed the most and what I tell my patients is that 10, 12 years ago, or even when I opened my clinic, there was not a whole lot that I could say about how aggressive is your disease going to be, when are your kidneys going to fail. All I could really say is if your parents had aggressive disease, you probably will, or if they didn't, they won't, and things like that. But now we have established tools of how big are your kidneys, will tell you how aggressive your disease are, will give you a good estimate of what is going on. And what are some non-pharmaceutical interventions that everyone could incorporate into their lives, those sorts of things. Ask them about those things and ask if they can get, I'm clearly biased because I'm part of this community and this is what I do, is take care of individuals with PKD. But I think everyone should have a kidney volume done to see how aggressive their disease are and give them more information, and things like that. And a lot of nephrologists don't have the capability to do that, not because they can't do it, but they don't have a facility. Here at UT Southwestern, we can do that, but a lot of rural places can't. I will tell you that more and more nephrologists are starting to refer to us for those specific reasons. So those would be sort of some of the questions. Ask about trials, ask about drugs.
Yeah, absolutely. And, and you gave some really great tips for ensuring your entire team is aware of your PKD and making sure they're talking to each other. What advice do you have for someone who goes to the ER for perhaps a pain event or something where it's harder to find a doctor that you're already familiar with?
So go to the ER, tell them that you have polycystic kidney disease up front. And then, go ahead and ask them to reach out to your kidney doctor while you're still in the ER, if possible, if you're concerned about what is going on. I understand that if you go in the evening, you may not necessarily get a hold of me right away. At bigger institutions, there is someone on call at night. If you call our institution, it will not be me, but some other kidney doctor will be able to pick up the phone and get that message, and sometimes when it's very important and they can help triage what it is, and if it's something that really needs me, they'll find me, and things like that. So, I would urge you, either you directly send a message and go to the emergency room, or and you tell them that you have.
Great. Yeah, and you talked about this, but it can be really overwhelming and challenging to go through the PKD experience, getting diagnosed, going through, heading to kidney failure. What kind of advice do you have for your patients regarding mental health, or getting support for dealing with just the emotional and social challenges of having a disease like PKD?
But first, I would say that you are right. It is a real problem, and no one should miss the mental health component of polycystic. It is a burden both physically and mentally. And I acknowledge that that is real. It's good to develop a support system. Talk to your PKD doctor about it. That is one of the more common things that we do discuss. It affects you, and it will affect you differently over time, and in something that was not such a big deal will become a bigger deal, and things that were overwhelming may slowly become less overwhelming. And this community provides a lot of support. But in addition, they're needing an antidepressant to help you deal with this, or an anxiety medicine, is not because you're not tough enough to brave it out. It's because that is part of the medical care that you need for your polycystic kidney disease. Do not be ashamed of that. And I think acknowledging it, talking about it, and appreciating that it is okay will make you have better outcomes for healthcare.
Fantastic. Well, thank you. This has been a really great talk, and I appreciate answering our questions. Do you have any final comments before I end with some announcements?
So I saw one question that popped up, and I know there are a lot. But one of the ones that caught my eye was, and I didn't read the whole thing, so I apologize, but about getting insurance approval for tests, for the test that PKD specialists try to order, and how difficult that is. So that is changing a little bit because of the availability of tolvaptan and the requirement that it requires for you to have aggressive disease before you can have it. The approval for an MRI for your polycystic kidney to determine the size and stuff like that is becoming easier. If you go to a PKD center, they should have a way to help you get around that. Here, what I tell my patients is that do not go pay anywhere else to get that MRI done. Tell me if they tell you, I tell you, I want you to have it here so I can get the proper sizes. If they tell you it's cheaper to get it done somewhere else, please don't do that. I won't get the information you need, and it will cost you unnecessary money. Tell me, and I will work to try to get it approved to the best of my ability. I understand the cost, even with medicine, but you have to tell me and work with me, and then ask, well, if I don't do this, what do I lose or what do I gain? And we have to work with a plan that works for you.
Great. Thank you for catching that. Really good question. Yeah, thank you everyone also for joining us.